Welcome to Celebrity Scoop, your trusted source for the most critical headlines and stories that everyone is talking about. Today, we're shedding light on a shocking development: new guidelines at VA hospitals across the United States. These changes, sparked by an executive order, could potentially allow medical staff to refuse treatment to unmarried veterans, and even those with certain political affiliations. This is a story with far-reaching implications that could fundamentally alter the largest hospital system in the US. Stay tuned as we delve deeper into this shocking development. So what exactly has changed at VA hospitals? Well, let's delve into it. In the wake of an executive order signed by Donald Trump titled "Defending Women from Gender Ideology Extremism and Restoring Biological Truth to the Federal Government," there has been a significant shift in the operations of the Department of Veterans Affairs. Some of these changes are already in effect in certain hospitals, and they're causing quite a stir. The most shocking alteration: the medical staff at VA hospitals, we're talking doctors, psychologists, dentists, and nurses, can now refuse care based on political affiliation or marital status. Yes, you heard it right. If a veteran is unmarried, a Democrat, or a member of a union, the healthcare providers can turn them away without any repercussions. But the changes don't stop there. VA staff can also be prevented from working at these hospitals for the same reasons. The potential for discrimination is quite staggering, isn't it? And there's more. The VA has put a stop to most gender-affirming care. Words like transgender and gender-affirming are now banned from clinical settings. The intention might be to restore biological truth, but the impact on veterans requiring such care could be profound. Dr. Kenneth Kaiser, a former VA health chief, is among the critics of these new rules. He worries that veterans could be denied care for deeply personal reasons, like a history of sexual assault, past drug use, or even their political views. It's a grim picture, isn't it? Let's put this into perspective. The VA is the largest hospital system in the United States, serving over 9 million veterans every year. The implications of these changes are not limited to a few individuals. They could potentially affect millions. Supporters of these changes, most of them Trump supporters, argue that they're about restoring traditional values and protecting free speech for doctors. But opponents view it as an attack on vulnerable communities and a political move that puts lives at risk. The debate is heated, and there's a lot at stake. In a country where healthcare is already a contentious issue, this executive order has added another layer of complexity. The question is, are these changes in the best interest of the veterans they're meant to serve? These changes could have far-reaching implications for millions of veterans. The conversation is far from over, and as always, we'll be here to guide you through it. Stay tuned. Opening, the reaction to these changes has been varied and intense. Let's delve into the whirlwind of responses these alterations have stirred. The supporters of these changes, largely aligning with the conservative camp, have voiced that this executive order is a beacon of light, restoring traditional values that have been overshadowed in recent times. They argue that it's about safeguarding the freedom of speech for medical professionals. The idea here is that doctors, nurses, and other medical staff should have the liberty to act in line with their beliefs and personal values without fear of repercussion. But what does this mean in practice? Supporters suggest that the changes could facilitate a more personalized care environment where medical professionals and patients share similar values, potentially leading to better rapport and understanding. They believe that this could foster a more comfortable atmosphere for both parties involved. On the flip side, opponents, predominantly from liberal quarters, view this as an overt attack on vulnerable communities. They see it as a political maneuver that puts lives at risk, a step backwards cloaked in the guise of traditional values. Fears of discrimination based on political affiliation or marital status have sparked outrage and concern, as critics argue that medical care should be impartial and universally accessible, irrespective of personal circumstances or beliefs. The implications of these changes, critics argue, could be far-reaching and potentially devastating. The VA is the largest hospital system in the US, serving over 9 million veterans every year. That's a significant number of individuals who could potentially be affected by these changes. Critics worry that this could lead to dangerous levels of discrimination, with veterans being denied vital care for deeply personal reasons, like past drug use, sexual assault, or even their political views. Former VA Health Chief Dr. Kenneth Kaiser's reaction echoes this sentiment. He warns that these changes could lead to veterans being denied care for deeply personal reasons, a stark departure from the fundamental principle of equitable healthcare. The tug-of-war between these contrasting viewpoints has ignited a fierce debate that continues to rage on. Some argue that it's about free speech and traditional values. Others see it as a dangerous step towards institutionalized discrimination. The question at the heart of this debate: should medical professionals have the right to refuse care based on politics or lifestyle? It's a question that weighs heavily on the minds of many, and one that is unlikely to see a unanimous answer. In the midst of this controversy, it's important to remember the individuals at the heart of this issue, the veterans who rely on the VA for care. Their voices and experiences should be at the forefront of the conversation, shaping the narrative and guiding the decision-making process. Closing. The debate over these changes is far from over. Now let's consider what these changes could mean on a personal level. Picture this: a veteran who has served their country with honour is denied necessary medical care because they are unmarried or because of their political beliefs. Imagine a former soldier who has survived the horrors of war only to be denied care for a serious condition because they're single. Or a veteran who needs urgent medical attention but finds the doors of the hospital closed because they're affiliated with a democratic union. Consider a brave individual who has struggled with their gender identity, seeking affirmation and understanding from their healthcare provider, only to be met with denial and dismissal. They came for help, they came for care, but they were turned away because they don't fit within the traditional values outlined in the executive order. Dr. Kenneth Kaiser, former VA Health Chief, has expressed concern over these deeply personal scenarios. He warns that veterans could be denied care for deeply personal reasons, like a history of sexual assault, past drug use, or even their political views. Can you envision a veteran who has experienced the trauma of sexual assault, seeking help, only to be denied because of a rule that allows medical staff to refuse care? Or a veteran striving to overcome past drug use, seeking assistance to get their life back on track, but finding the doors of the hospital closed to them? The potential for discrimination isn't just about politics or lifestyle. It's about denying care to individuals who have served their country, who have sacrificed and suffered, and who now need our help. These are the people who could be most affected by these new guidelines. These personal stories highlight the potential dangers of these new guidelines. They make us question the fairness and the humanity of a system that allows such discrimination, especially towards those who have served and sacrificed for their country. So what do you think about these shocking changes at VA hospitals? It's a topic that certainly merits discussion, and we'd love to hear your perspective. Should medical professionals have the right to refuse care based on political leanings or marital status? What are the potential implications of this policy on the healthcare of those who served our country? These are not just abstract questions, but issues that could affect millions of veterans. It's not just about politics, but about basic human rights and dignity. And as we've seen, the consequences could be far-reaching. But it's not just about sharing your thoughts, it's about starting a conversation. Talk to your friends, your family, your neighbours. Share this video, spread the word. Because change often starts with a single voice that refuses to stay silent. And remember, everyone's opinion matters. Whether you're for or against these changes, let your voice be heard. Let's foster a space where we can respect differing opinions, yet still stand up for what we believe in. Because at the end of the day, it's about people. It's about those who fought for our freedom and now find themselves in a battle for their right to healthcare. This is Celebrity Scoop, bringing you the headlines that matter and the stories everyone's talking about. Don't forget to like, subscribe, and hit that notification bell for more.